Good morning, everyone, and welcome to our webinar, COVID-19 and Healthcare. Thanks for joining us. My name's Claire Nivrovich, and I'm the Director of Prevention Strategy at WorkSafe Victoria, and I'll be your host for this session this morning. While our program of sessions is virtual this year, we have the same aim that we always do for Health and Safety Month, which is to keep you informed. And our focus for this year is navigating through COVID-19. I'm going to be joined in our session today by three of my colleagues who are experts in this area. Dr. Natassia Good is the Manager of Programs for Healthcare and Social Assistance at WorkSafe Victoria. Hi, Taz. Amanda Tonks is an Inspector at WorkSafe Victoria. Hi, Amanda.
Hi, everyone.
And Chris Azam is a program officer at WorkSafe Victoria, who also works in the healthcare and social assistance area. Welcome, panelists, and thanks so much for being here this morning. So our event this morning is structured as a conversation between myself and our WorkSafe experts. And we're going to outline the importance of good mental and physical health in the healthcare and social assistance workforce, and most particularly in the really difficult times that we've been going through recently, where these workers are so exposed to workplace risk. Remember, if there is anything that you need to speak to WorkSafe about more urgently, you can get in touch with our WorkSafe advisory line or also our emergency line, and you can see the details there. And just a couple of housekeeping matters before we get into it. If you'd like to join in the conversation on your social media channels, if you could do that using the hashtag HSmonth, that would be wonderful. So I'd like to extend a really warm welcome to all of you, our viewers today. Thanks so much for being here. We're going to start with you, Chris. I'd like you to please give us a bit of an overview of this diverse sector, the healthcare and social assistance industry. Can you give an indication of the kind of workplaces that your team supports in that industry?
The sector is actually quite massive. You're right in saying how big it is. We support public and private hospitals, residential aged care, disability, early childhood settings, out-of-home care, primary health networks, allied health, in every possible setting. And just to properly clarify how big a sector it is, we have 14.9% of Victorian workers employed in healthcare and social assistance sectors. And the industry makes up 8.5% of all workplaces in the state and 13.1% of all hours worked by Victorians.
Thanks, Chris. That's really great context to have. So, Taz, I'm going to move to you now. Can you talk to us about what your group at WorkSafe has done since the COVID threat became so real earlier this year?
Thanks, Claire. So, as always, our focus has been on ensuring that the health and safety of workers is the core priority for employers in healthcare and social assistance. But in March, when we really started to understand what the pandemic meant, our work shifted completely to focusing on identifying and addressing the risks due to COVID that were emerging in the healthcare and social assistance industry. So as a first point, we established working groups with unions, peak bodies, employer groups, DHS and Safer Care to really better understand what those risks were and how the role that WorkSafe might play in addressing them. And then we had to work really rapidly to develop guidance for the sector. So we looked at international best practice, the experience overseas, and we quickly developed guidance on preventing and managing COVID due to the risks relating to COVID. And then following that large piece of guidance, we then developed tailored further guidance on specific issues as it arose, such as respiratory protection equipment, fatigue, and mental health. Then we also had to make sure that our inspectors were equipped to do the work and respond to the incidents that were occurring. So we developed tailored tools for them, but we also set up communication channels to make sure that they were equipped with the most up-to-date guidance because it was changing so rapidly. So that was our approach.
Great, thanks, Taz. That's really interesting to hear all of that. And you did just speak about the support for inspectors. And so, Amanda, if I can come to you now, you're a nurse by profession, and have since become one of our WorkSafe inspectors. Can you talk a bit about how COVID has changed the way you do your important work and what you're looking for out in your workplace visits?
Yeah, thanks, Claire. Here at WorkSafe, like all you guys out there, we had to change the way that we did our work. And one of the ways that we did was to set up what we called virtual visits. So rather than going on site, we did a virtual visit. So the key thing was for everyone out there is what's a virtual visit consist of? This was a phone call or a Skype call to a workplace, and then a robust discussion about what was actually happening on site. So we would focus on getting managers, health and safety reps, other employees from various sites, kitchens, maintenance, all those types of areas, on board to come and have a chat with us to see what was actually happening out at the work site without actually physically being there. Sometimes the workplaces would send us photos or information which we could review and have a look at and pass comment on. And that was a really good way of not actually being on site, but having a really good look around the workplace. Obviously, the focus was on COVID, and the key areas that we were focusing on was things like infection control, outbreak management, and the good things that we were able to do also was provide information to the workplace and also listen to their concerns and come up with alternative measures or suggestions for them to implement at the time.
Great, thanks, Amanda. That really paints a picture of what you've been doing. Just to follow up on that, with the changes that you've made to inspector visits in the healthcare and social assistance industry as a result of COVID, do you anticipate that those changes will be long lasting, or do you think that once the pandemic comes to a conclusion that you would go back to how things were before?
Well, Claire, just like everybody else, I'm not sure when this COVID is going to be over and done with, and I don't think anybody else is either. I'm already back on the ground running. So I was at aged care facility yesterday. So it was face-to-face, and it was really good to get back on deck and talk to the staff, which were very happy to be on site because we could actually see things and look at things. Yes, I was absolutely kitted up with all my PPE and stuff to enter the facility, but theoretically, we've come out with the brilliance of what we've implemented now can be carried on into the future. So with any other issues with infection control, they've learnt a lot in having setups ready to go. But it was really good yesterday, especially, and with other site visits that I've done, to actually get on board and hear what they had to say and what their key issues are.
Thanks, Amanda. Taz, I'll just come back to you. You mentioned a little bit earlier that you were doing lots of interaction with other organisations as this unfolded. I gather that new and strengthened industry collaborations have been a key feature throughout. Could you talk about how this has worked and what the results have been?
Yeah, that's been really important for us because healthcare and social assistance is a really complex regulatory environment, and there's lots of different parties providing different advice to people. So we've really had to all come together to make sure that the advice is aligned and that we resolve any confusions for employers to make sure that they know what they're supposed to be doing. So some of the things that we've done is set up working groups for each of our subsectors, for example, in hospitals, aged care and disability. Our hospital group brings together DHS, Safer Care, the employer groups and the unions to really identify issues, consult on guidance and identify ways that we can collaborate to solve these issues that are coming up for the hospitals. Another example is our aged care working group, and this is actually pretty special because it brings together the federal government parties, so Aged Care Safety and Quality, and our state government counterparts, so the Victorian Aged Care Response Centre, DHS and Safer Care, as well as the unions and the employer groups. And it provides a way of ensuring that there's not too much regulatory overlap in terms of the workplaces that we're visiting, but that also our messaging is really aligned to employers as well. The results, from my perspective, have been that we've had better quality guidance come out from all of the parties. Potentially those regulators who haven't traditionally considered health and safety concerns of workers have a new perspective due to the COVID pandemic. And we've also managed to create an environment where we're able to work on really short timeframes, which is a new way of working for government.
Great, thanks, Taz. And just to, I guess, go a bit further there around some of those collaborations with other government agencies, obviously that has been such a strong focus for WorkSafe under the COVID rules. Can you talk us through, another example about some work you've been doing there?
One of the really significant initiatives is the Healthcare Worker Infection Prevention and Wellbeing Task Force that's been set up. So that's a collaboration between WorkSafe, DHS, Safer Care Victoria, the unions and other experts in the field. And that task force has come together to try and understand why the rate of healthcare worker infections is so high in Victoria and what do we need to do about it. And so far, really that group has been changed the information that's available about healthcare worker infections. So we now have really good quality data about which settings are most at risk, which workers are most at risk, where have those infections been. But we also better understand the contributing factors to the outbreaks across those different settings as well. That task force has also produced the Safe Amenities Guidance for hospitals, which provides really good tailored advice on how to control the risks associated with break rooms, communal areas, and most importantly, the Respiratory Protection Program Guidance, which is a mandatory program for all health services and provides basically information about how to implement the Australian standards for respiratory protection, including fit testing.
Thanks for that, Taz. That really paints a picture of some of that work. Chris, I'm going to come to you now. I think, one of the key factors that's been identified as playing a role, and as Taz was saying, there's been that work to look at some of the contributing factors, but one of the key ones that has come up is fatigue. And WorkSafe have developed some specific guidance on managing that during a crisis. Can you talk to us a bit about how workplaces can mitigate fatigue in their workers?
Yes, probably the most key important thing to do to prevent fatigue in your workers is communication. Communicate with your staff. Consult your workers on things like rosters, and while following the guidance on all the hours worked, talk to them about what to expect in the workplace as best as you possibly can, and also explain to them that with COVID, it's really hard to predict things. And while it's hard to predict things, if you know things could be hard, tell your workers things will be hard so they can prepare themselves as well. And also, get their feedback, have a forum where they can talk to each other and they can talk about things that they're having difficulties with, whether it be things like motivation or concentration or even sleeping. And with these forums, they give you as an employer an opportunity to hear from your staff and hear what the difficulties are, and you can plan things to control that. So you can have really simple yet effective controls like task variation or even shift swaps or even referring them to EAP services as well. The controls don't have to be these big, complex, scary things. They can be super simple and super effective.
Thanks, Chris. Another thing we've talked about throughout is, some of the things that have been done in relation to education about this evolving situation. Could you talk about the things that have been developed for a COVID world and how those tools have been received?
Yeah, so we've been doing quite a few webinars. So we've done two, just on physical, mental and emotional fatigue, how to assess the risk and control it. We also have a webinar on the COVID fatigue guidance that we've put together. We've done another webinar on clinical waste management, and that was supported by DHS, DHHS, EPA, and NDS. And that particular one had a focus on the identification and correct disposal of clinical waste. And our most recent webinar, I believe, is one explaining the COVID claims process to employers. And this particular webinar was a little special because the content was all based on questions that we had submitted by the attendees prior to the event. We also have put together an HSR forum, so Health and Safety Rep Forum. This is an ongoing forum. It's conducted by WorkSafe and the National Disability Services. And its purpose really is to support HSRs in the sector and bring them together and for them to find a space where they can talk about issues and work through things together and share their learnings. And we're also lucky enough to have expert presenters to talk about solutions and case studies of things that they're working on. Another thing that we've done is checklists. So one particular checklist is a checklist for the early learning employers, and I think that's in its sort of final stages of development. It should be published soon. That's being supported by our OHS Essentials program. So if you haven't heard of our OHS Essentials program, look it up, it's great. This particular checklist covers all the OHS requirements and anything that early learning services will need to know to address before we enter this sort of COVID normal world. And, you know, like Tess said before, we've developed really good targeted guidance for the sector on particular topics like fatigue and respiratory protective equipment and new return and redeployed workers.
Great, thanks, Chris. And that's a great plug for our OHS Essentials program. So make sure you jump on our website and find out more about that one. One of the things that's been really clear as you've all been speaking this morning is about, you know, the different parts of the sector and the need to focus in on the particular context. Chris, just staying with you, I'm really interested to hear about the aged care sector. As everyone would know, you know, they've been significantly impacted throughout the pandemic. What's been specifically done for that part of the industry, Chris?
Yeah, we've been working with the aged care sector since March when the pandemic really exploded in Australia. So, you know, what happened in other countries and how did they address the problems? And we use this as our evidence base to develop our guidance. At the beginning of March, we started our proactive virtual inspections, so something that Amanda was talking about before. And these really focused on ensuring that employers had implemented systems to prevent worker infections and maintain it over time. We also established regular consultation groups, so again, communication with our aged care employers, peak bodies, unions. And from this, we were able to identify things like the webinars that we produced and also really collaborate on guidance that everyone was working on and provide feedback from an OHS perspective from WorkSafe and also have everyone else's perspective put into our guidance. At the moment, we're working on a project for the culturally linguistically diverse workers. And this project really is designed to help not only translate material, because that's one thing that is super important, but also put together a program for, you know, culturally and linguistically diverse communities to be able to find each other and share their experiences and learn from each other as well.
Thanks, Chris. That sounds really interesting. Taz, just coming to you, I noticed one of the things Chris mentioned just then was around, you know, having those systems in place. I'm really hearing about, you know, those preventive and mitigating systems are all important during this time. Could you summarise sort of a key message or take out on that theme for our viewers today?
Yeah, that's right, Claire. Our message is always that employers need to put controls in place to prevent health and safety risks to workers. So this means preventing exposure to COVID in the first place, so putting those higher order controls in, and then providing further controls to reduce the risk of infection in the workplace where they are directly interacting with people, but also ensuring that they focus on preventing those secondary risks that are arising due to the pandemic, the stress, the anxiety and the fatigue. And really you do that through good quality health and safety management systems. But through this, consultation is really the key, because you can have the best idea, but it might not work in practice. So this means consulting with staff and HSRs on all of the controls and the changes to the workplace while you're developing those COVID-safe plans, but also over the life of the plan as well, as things evolve and change in the workplace, the cohort of patients that are coming in. Just continuing those conversations with staff and HSRs and making sure that the controls that are in place are actually functioning, effective, and tailored for that specific setting.
Thanks, Paz, and also Chris and Amanda. It's been such, interesting information that you've been able to share with our viewers today. So thank you very much for your participation. The mental and physical health of our healthcare workforce is just so vital into the future. To stop the spread of COVID and beyond, healthcare workers are really our last line of defence, and so their health and safety needs to be a top priority. We've heard today about a lot of practical tools and information to help with the issue of COVID-19 in the industry. We've heard about guidance on prevention and management of COVID, about fatigue during COVID, about new returned and redeployed workers, about some webinars that have been running. So please make sure you're checking the WorkSafe website, which is a great place to go to find out information about these things. And shortly, we'll show on screen a list of contacts that we've mentioned. If you've got any questions or requests for further information, please do get in touch. Thank you so much for tuning in for this session today, and please enjoy the rest of your day.